Texas Children's Hospital. I'm the Assistant Director of Acute Care Medicine, and I come to nursing through second career. So before that, I was a nonprofit business, and so negotiating the hospital was eye-awakening for me because there's a lot more bureaucracy in a nonprofit business. But it's been fun to bring that background into the hospital and see how that can be utilized. So I'm talking about strategic plans, and so I tease my boss all the time that I cannot go to lunch without being pinned in some corner by a chief that says, so when do I get my nurse practitioner or my PA? So I said, I think I have to start ordering lunch in to avoid some of those conversations. But we've put together over the year 17, just in my section, we have 5 sections of the hospital, but just in my section, 17 plans for FTEs for acute care medicine. We also do business plans for compensation changes. So I'm kind of talking about the nuts and bolts of that. So I love this quote, and it says, a goal without a plan is just a wish. And so if you really want to drive for an FTE, you really need to have not just a goal, but you need to have a plan in place. And so we have a workforce structure that we do our business plans. And that aim is really to create this user-friendly kind of document. I think it's should be like the Apple kind of friendly. For non-clinicians and for clinicians, because when people are reviewing your business cases, maybe half of those people are business people and maybe the other half are clinicians. And so you want to make sure that you can speak to that common denominator. And you're going to advocate for maybe FTEs, management compensation models, or even staffing changes that you might be doing a business plan for. So I came up with my pearls or my guiding principles when I'm putting together a business plan, and that's keep it clean and simple. Make it elegant and professional. When you look at that little business plan, it needs to be elegant and simple and easy for everyone to read. The goal is to do it in 2 pages. So edit, 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 and then when you think you're done editing, edit it again. I use lots of visual images, especially because you have people that are not in the medical world that are looking at this plan. So the more visual images that you can show, if you can show a trajectory. So I just did one for the epilepsy monitoring unit, and we had a diagram that showed the epilepsy clinic, the epilepsy monitoring unit, and then neurosurgery. And then we put a block at the EMU because we don't have enough staff currently in our EMU. And so therefore, there is a block because we have a lack of providers to getting from the epilepsy clinic to neurosurgery. Well, what does that mean? We're losing revenue. And so by just having a simple diagram that puts a slash right there and says, this is our block right here, simple, easy, any business person can understand that, and any clinician can understand that. So finding visual images and word smart, the smart art is your best friend in the entire world when you're doing a business plan. Don't use acronyms or jargons. People don't get it. The business people are like, what's EMU? What's APP? What's PANP? Spell it out for them. And always verify your facts, especially if you're doing projections where you say, we think that we need 2 nurse practitioners for our cardiology preventative clinic because we have a proposed that we're going to be bringing in $100,000 next year. You need to really verify your facts because if they come to next year and you didn't bring in any money, that's going to be a questionable for that FTE and they're going forward. Have a non-clinical person read your business plan before you turn it in and see if they understand it, verify understanding. Like you would do with a parent and a family before you send them home. Find someone who doesn't do anything clinical and sit down with them and say, do you understand what I'm trying to say here? And have them say it back to you. And if they understand it, you're good to go. And number all of your handouts. So if you're going to have a handout, this is really basic. Handout number 1 is the business plan. Handout number 2 is my diagram. Handout number 3 is this. So when you're actually presenting this, or in many cases like our hospital, our CNO is going to be presenting this, she can say, please refer to handout number 1, now 2, now 3. Very basic, but it really makes a difference for organization when you're presenting. I'm going to go real quick. So there's 6 areas of our business plan. It's going to be posted on the Melnic website. Objective, just a short and sweet statement. To create a new APP position for cardiology, for preventative heart clinic, whatever it may be that you're looking for. Then the next section of that is a background. This is the most important section of the business plan. It's either that you're going to be expanding the current role or adding new people to that role, or you're going to do something innovative. If it's something innovative, this background section needs to be very robust. If it's a section that you already have current APPs in it, you may just need some drivers in there to show why you need more people. There's 3 components in the background. One is medical. So meet with your chiefs, meet with your medical directors, meet with your current APPs and say, why do we need this role? And find out from them and get an understanding. I also go back and read the literature. We were doing one for our preventative heart clinic. So I went back and I read the NIH guidelines that are coming out that says every 9 to 11-year-olds should be screened. That means we're going to have a lot more kids coming to the hospital. So I could use those NIH guidelines in the business proposal. So there was the first part of that background is medical. The second one is going to be financial. This is when you become absolutely best friends with the practice administrator, your PSO, your HR person, whoever it is that's going to give you the business driver. You want to be taking them to lunch or doing what you can, because they can give you the justification for why you're going to be needing that. You don't need to dig for that. They already have it for their department. So becoming friends with them and utilizing that to help promote their department, they're usually pretty generous with that information. You can use revenue, work RVUs, number of patients seen, projected income, return on investment, third patient available, left without being seen rates for the EC, staff to patient ratios. Those are some of the drivers we use. Another one is national benchmarking, and I have been calling a lot of the hospitals in the country. This is now required for our business plans. So I'm calling up to hospital A, B, and C, and D and saying, how many nurse practitioners do you have in your pre-op clinic? And then we did a graph and we said, oh, there's 6 at this hospital, there's 8 patients per day in this hospital, there's 12.5, and ours are seeing 18. That spoke volumes. They said, we really need to add some people to that clinic, so we're hitting more of a national benchmark. So those are the drivers that I put in that background. Then the position details that you'll see in there is just a simple statement, full-time, part-time, NP for a blank department. Benefits, just kind of going through there. There's practical and pragmatic, strategic, and showing a connection. You want to put that information in there. And then there's a section that says risks if not implemented. These 2 things always exist in there. Decreasing patient availability and decreasing patient safety is number 1. And number 2 is overburdened staff, risk of burnout, turnover, and lack of job satisfaction. Those are always in my risks. But you can find the ones at your institution that would be a part of that. And then other options to consider is that you would have to recruit physician staff instead of having the APPs, or you would have to offer overtime. And then there may be other ones specific to your institution. So those are the different components of the business plan. I always send a summary sheet with the business plan. So if I put together my 2-page elegant summary, then I send a talking point to our CNO so that she has a talking point. These are the things I want her to highlight. I want her to understand every graph that's on there. I want her to be able to speak or address to it. And even if I am presenting the case, I still make a talking point sheet for myself. And meet with the presenter before you meet.
Thank you very much.